Okay, so today we're going to talk about psychological disorders. I know you've already probably watched a couple crash courses and some information about what makes something abnormal. So I'm going to try to not review that information. Make sure you watch those other videos. So psychological disorders are called many things, I guess. So the study or the scientific study and understanding of mental disorders is called psychopathology. It's also called abnormal psychology, mental health psychology. There's lots of different names. They're pretty interchangeable for our purposes. Okay, so psychopathology, the understanding and study of mental disorders. Historically, the treatment of mental disorders has not been overly positive. So lots of belief that psychological disorders were the result of demonic possession, that we have to release those through triphoning, which is drilling a hole through someone's skull to release the demons, exorcism, those kinds of things. Drilling a hole in someone's skull does not cure mental disorders unless the mental disorder is actually caused by swelling in the brain, which is very rare. So what is considered abnormal? Well, abnormal, you already have talked about these things, the 4 criteria for abnormality, right? They use the 4 Ds, but I have the words that are synonyms. So atypical, something that's deviant or not typical in the population. Maladaptive, something that's not helping the person survive. Distressing and irrational. Most mentally ill people are not violent. Only 12% of people believed that myth at the beginning of the semester, so that's good. We use the DSM-5 now. It's relatively controversial because the way that it's created doesn't necessarily follow sort of statistical understanding of mental disorders. There's a lot of overlap, but we still use it. So the DSM is where we can find information about all psychological disorders that are well substantiated with evidence, even though there's overlap among them. So when we think about psychopathology or mental disorders, we think about the biopsychosocial approach. Okay, so we think about causes being both biological, social, cultural, cognitive, behavioral. We think about all of the interaction of these factors, right? So genetic predispositions, life experiences, all those things leading into and influencing the presence of a mental disorder. So today we're going to talk about a slew, or in these videos we'll talk about several different psychological disorders. We're certainly not going to cover them all. The DSM has over 500, but it's important to know that after this lecture you are not qualified to talk to anyone about their mental disorder or diagnose anyone. Okay? We're only going to talk about some of them. You can take abnormal psychology if you want to learn more, but just please don't be this guy. Don't analyze people. Don't try to tell them about their mental disorders or self-diagnose. It might be hard, especially given our life situation right now, but try not to. Okay? So first things first, when we talk about psychological disorders, it's really important to use person-first language and speak about everyone with respect, okay? So person-first language is referring to an individual with schizophrenia or an individual who suffers with depression, okay? So we're not going to refer to people as their diagnosis. So I'm not going to say a schizophrenic or, I don't know, a bipolar, I don't know. So we always use person-first language. It's really meaningful. People are more than just their diagnosis, so we should refer to them as individuals first, diagnosis second. In any given year, 1 out of every 5 adults in the U.S. has an experience with a mental health disorder. This is not something that is, drastically strange in the population. So let's treat people with as much respect as humanly possible. So some of the categories of mental disorders that we're going to talk about today are anxiety disorders, obsessive compulsive disorders, depressive disorders, bipolar, and schizophrenia. These are just some of the major categories. They are the most frequently diagnosed, so we're going to just talk about those today. Okay.